About 15% of women and 6% of men suffer from migraine headaches. In children, 10% of girls and 6% of boys also suffer. Migraine is a common condition that affects people of all ages and races. Dizziness is a common association of migraine in many patients. Migraine-associated dizziness or migraine-associated vertigo occurs in up to 3% of the population. Because the symptoms can vary widely and there is no blood test, X-ray, or MRI to confirm the condition, the diagnosis of migraine-associated dizziness may be difficult to make and outcomes of treatment difficult to assess. Especially difficult to diagnose are the many patients who present with confusing and distressing symptoms of dizziness without a headache. These patients frequently undergo extensive testing that is either normal or nonspecifically abnormal. However, bizarre forms of migraine are both common and widely accepted. Here is a simulation of scintillating scotoma, a good example of a common form of visual migraine that can occur with or without a headache. In many sufferers, this visual distortion signals that they will soon have a migraine headache. However, many have the scintillating scotoma without getting a headache. Vertigo is the sense of self-motion when no motion is occurring, or the sensation of distorted self-motion during an otherwise normal head movement. For most vertigo that arises from an inner ear malfunction, the sensation is of the spinning that you may remember from rolling to the bottom of a hill, as a child, as depicted in the video. The sensation is accompanied by involuntary twitching eye movements called nystagmus that can be observed by someone examining the person at the time they are dizzy. While the spinning type of vertigo can occur when dizziness is due to migraine, often the sensation is of rocking and swaying to and fro, like on the deck of a boat. This video tries to depict this, but the symptom is not so much of a visual experience as the video shows, but an internal sensation. This sensation is usually not accompanied by nystagmus, but may be. 30% of patients eventually diagnosed with vestibular migraine present without headaches. This is a condition that is much more common in midlife and affects many more women than men. Although the mean age of headache onset in patients with vestibular migraine who actually have headaches is typically at 28 years, the average age of dizziness onset among these patients with vestibular migraine is about 50 years, with a 3-to-1 female preponderance. The dizziness of migraine can vary widely from patient to patient, and even from time to time in the same patient. The spells may be very brief or may last weeks, or in rarer cases, months. When the events last a long time, they tend to wax and wane without really going away completely. These individuals may have pressure in the head, including sinus pressure, pressure in the ear or ears, or both pressure in the head and the ears that fluctuates. They may also have fluctuating ringing and mild hearing loss in one or both ears. Up to 50% of childhood vertigo cases are probably related to migraine, including vestibular migraine, and benign paroxysmal vertigo, or BPV of childhood. BPV of childhood is the most common cause of vertigo in early childhood. In children between 5 and 15 years of age, the estimated prevalence is 3%. Note that BPV of childhood is not benign paroxysmal positional vertigo, or BPPV. BPPV is the most common cause of vertigo due to the inner ear. There is a strong connection between migraine and Meniere's syndrome, since up to 60% of patients with Meniere's syndrome have symptoms of vestibular migraine. More than 10% of patients with vestibular migraine later develop hearing loss typical of Meniere's syndrome. Motion sensitivity in childhood, car sickness for example, is a common but not specific predictor of migraine-associated vertigo in adulthood. Although a few small studies suggest that triptans, like sumatriptan or Imitrex, may have modest benefit in some patients during vertigo attacks, most reports on the use of triptans for vertigo and vestibular migraine are inconclusive. In my experience, triptans in acute migrainous vertigo are rarely of benefit. Patients seldom report using the medication after an initial trial. The only treatments that can presently be endorsed for acute attacks of vestibular migraine are medications that reduce nausea or vomiting. Despite the relative lack of controlled studies demonstrating benefit, many who treat dizziness due to migraine recommend that the first measures to treat the condition include avoidance of dietary and behavioral triggers and sleep hygiene. For example, 15% of patients with vestibular migraine note improvement with stopping caffeine alone, although relief for most is not complete and preventive medication is often prescribed. While many drugs have been established as effective prevention for chronic episodic migraine headache, no one medication works in all patients. Unfortunately, some patients don't get relief from medication. Although the effectiveness of most of these drugs has not been evaluated in vestibular migraine, it seems reasonable to try them in patients suffering from chronic vestibular migraine. Whether you start daily medication for vestibular migraine should be a decision you make after discussion with your doctor. You should base the decision on how disabling and frequent your symptoms are. Vestibular migraine remains a diagnostic and treatment challenge. Increasing acceptance of the condition as an independent diagnosis by neurologists and otolaryngologists leads to hope of better recognition of the many patients who suffer from it and development of effective treatment that is based on evidence. For now, suggested treatment is probably best described as dietary or lifestyle modification, anti-nausea and anti-vertigo medications for acute attacks, and consideration of preventative medication for patients who find the frequency or intensity of their dizziness or vertigo sufficiently impairing or disabling. The medications prescribed are the same that are usually used to treat chronic or frequently recurring migraine headache.